The Center for Disease Control is in charge of setting guidance on the order that populations get vaccinated, called prioritization. This guidance is based heavily on recommendations from the CDC's Advisory Committee on Immunization Practices, or ACIP. The federal government allocates vaccines to the states, who are responsible for implementing vaccination plans within their borders based on the CDC guidance. Mostly. States oversee vaccinations performed at the local level through public health departments and at places like hospitals, and eventually more publicly accessible venues like at the workplace or at local pharmacies. Between the CDC and states, there are a couple of federal agencies with important influence in this process. First, the Food and Drug Administration is responsible for actually approving vaccines. In theory, it can condition emergency use authorizations for the vaccines on specific prioritization requirements, essentially hardwiring the CDC and ACIP's guidance at the state and local level. But this command and control approach would undermine local autonomy and at this point is unlikely. The Department of Defense is in charge of overseeing allocation and transportation of vaccines to the states. In this role, it has made decisions that effectively diminish the role of CDC and ACIP guidance. Most notably, it decided to allocate vaccines to states based on total state population rather than on ratios of critical populations identified by the CDC and ACIP in each state. However, this has had a minor impact on the implementation of the CDC and ACIP guidance. If it feels like there are multiple different lists of who gets vaccinated next, that's because this process can be tweaked throughout. The ACIP can make recommendations that the CDC will probably but might not confirm in the guidance. The Department of Defense could alter that guidance based on how vaccines are allocated. States can diverge from the federal guidance in establishing their own vaccination plans, and as we will see, that is exactly what states are doing. Finally, myriad choices at the places where needles are actually stuck in the arms can ultimately decide who actually gets vaccinated next.